Hello, I'm Jason Mazakis, bringing you the update from Albany Medical Center Hospital. Today is Monday, April 29th, and joining me to my right is Dr. Ashley Taliski, our Chief Logistics Officer. Welcome, Ashley.
Thank you for having me.
We're going to have some fun today, and we're going to talk about updates and some recognitions. And then I really want to dig in and hear about the Logistics Center, which I think is a really special part of what we do here at Albany Med. So, this past week, Ashley, we had Volunteer Recognition Week. Do you know that we have more than 500 volunteers here at Albany Med, and they do a variety of functions, organizing our blood drive with the Red Cross. In fact, we had one just 2 days ago. We manage our thrift shop. They work with our auxiliary to arrange for vendor sales. That really helps support our patient care programs. They even schedule pet therapy sessions for our patients.
I love it.
And I know that you were once a volunteer. You started your career as a volunteer. Tell me about that.
I started as an undergrad in college with SUNY Albany. Had an opportunity to come to Albany Med. It was the first time I fell in love with Albany Med. And I volunteered in a few different locations, one of which was the emergency department, and absolutely found the most purposeful work. And I think that's what volunteering is about. You either find that passion or you give back to what makes you feel whole, and it's fantastic. It's fantastic to be a volunteer. It's fantastic to have volunteers.
Yeah, well said. I think it's that volunteer sentiment that really brings us together in our delivery of awesome healthcare. So thank you for that. We also want to announce our 2024 Juvenile Diabetes Research Foundation One Walk, which will be coming Sunday, May 19th, being held at the Great Escape. And this year, JDRF honors our nurse educator, Nancy Jones, as the Grand Marshal. So please consider joining and participating. It's an awesome cause. We also celebrated Administrative Professionals Day on April 24th. And we both know how important our administrators are. They really serve as our first touch point for so many of our patient activities, whether it's checking and registering our patients, and of course they support us in what we do in our administrative roles. And I'd like to give a special shout out to Maria Brett, who helps me tremendously each day of the week.
And Brooke Demarest, who definitely allows me to elevate in my position. So thank you, Brooke.
Another important announcement, we have our Epic Go Live or Post Go Live survey that is open until May 9th. This is an important way for us to collect some feedback, and as we prepare for phase 2, as we go live on our other campuses, so much of what we've learned will be lessons learned that will help to impart the wisdom to our affiliates across the entire system. How's it going for you in Epic?
I love it. I was fortunate to be a part of the build from the beginning, so to see it live, it's wonderful. And to help the system go live for our next wave, I think it's going to take our health system to the next level. So it's been fantastic for the staff, fantastic for our patients. So
that's excellent.
It's exciting.
I think the one thing that we both share in common is that so many of our decisions are now based on data-driven decision making, and it's really the visibility that Epic provides us that has really helped us. And we'll get to that in a bit when we talk about your logistics center work. We have lots of fun events planned for Nurses Recognition. Of course, as we build towards National Nurses Week, May 6th through 12th, we have recognitions that include our Salute to Nurses through the Times Union. That's coming. Our special AMC Pillars of Nursing Awards. And it's really an exciting time for such an important and vital part of our workforce. The nurses really are our lifeblood for the delivery of our care here at Albany Med.
It's great to celebrate them, yes.
We also celebrated Occupational Therapy Awareness Month, and the occupational therapists are so vital to so much of what we do in our recovery of some of our patients as they suffer through some neurologic issues and getting them back to what they need to do for their activities of daily life.
It's fantastic to think about, too, that that's part of the care that they receive here is some of the basic things, brushing your teeth, getting up out of bed. All of that allows people to go back home or back to their lives before being ill or having trauma. And so OT is such an important piece of what we provide for our patients to help them get back to being well or get back to their new well. And some of it seems so basic but so critical.
And I love what you pointed out as the comprehensive care of our patient.
Yes.
And that really leads to, it's a great segue, that we were reaccredited here at Albany Med as an advanced comprehensive stroke center from the Joint Commission. And this is a really proud moment, and it really highlights the incredible team, and it really does take a team to serve our patients that are suffering from stroke, starting with our ED staff, our nursing leaders, our providers in neurology, neurosurgery, interventional radiology. All of this really comes together into this amalgam that really serves these patients the best. And really, when we think about it, I'm looking at you, the role of logistics, and we've had some incredible cases. Tell me a little bit about that. And really, let's talk a little bit about what is a logistics center.
It's such a privilege to be a small part of the success story for our stroke program. But in logistics, it's like air traffic control. And so there were some stroke cases. Originally, I'm an emergency medicine doctor, have cared for stroke patients in the emergency department, absolutely a believer in our interventions, including neuroendovascular interventions. But I'll tell you, from the vantage point of a logistics center and chief logistics officer, a whole new perspective, seeing the continuation of their story past the emergency department and even prior to the emergency department. So an example I love to tell and to think about, we were able to collaborate with neuroendovascular specialists, Dr. Paul and Dr. Field, to really strengthen our communication, advance notice, especially of patients who are transferred in from other facilities into our facility. And so that preparation in advance and communication kind of allowing us to clear the path of the patient and clear the path for the staff. So in fact, they feel no barriers to the progression of the care. We had a case in which we were able to pull from another hospital, advance notice based on our use of incredible technology, Viz.AI, allowed us to know that there was a patient with a stroke elsewhere that was a candidate for endovascular intervention. Logistics Center was able to help pull the patient to our organization, facilitating the transport to get to us quickly by flight and ambulance, ensure that the ED was prepared to receive the patient. When the patient did come to the emergency department, quickly, everybody all the way through the care team to the neuroendovascular specialist were ready to go. And so within minutes of arriving to our hospital, the patient was in our endovascular suite and being cared for their stroke. And people who arrive with devastating strokes that potentially could have really awful outcomes leave this organization healthy as they were before their stroke. It's incredible to see what the team has been able to do just by some increase in communication and navigation of that care, which the Logistics Center we're so proud is able to provide. We were able to reduce arrival to the hospital to our VIR endovascular suite from, on average, before historically would be maybe about 74 minutes down to 12 minutes
It's incredible.
In one particular case. And seeing that type of turnaround time or decrease in time, all of that time is brain. And so it's so critical, it's so important, and the outcomes over and over again. I was a believer before. I'm an incredible believer now. To watch somebody go from being so very ill from a stroke to walk out of here with no deficits and be able to have a happy, healthy life over and over again. It's incredible.
Congratulations, too. I mean, I think you hit it on the head. The orchestration, time is of the essence for these patients. So much of what is hinged on in terms of successful outcome is exactly as you described. So really kudos to the awesome work that the Logistics Center and your lead, Dr. Taliski, and I'm very proud to have her on my team. You are one of the most engaged and present leaders, and that's really what defines your leadership, and I thank you for that. It's so incredibly appreciated. I think the other thing that logistics does, besides these miraculous stories, is the visibility that it provides for the flow throughout our house. So it's not often the case that we have days where we have struggles with moving patients from perhaps the ED or some other entry point to getting them bed access throughout the house. And your team has really helped to facilitate that movement. And that really allows us to do the care that we can do. So thank you for all of that.
Thank you.
Amazing. Well, we'll finish on a final announcement, a really important announcement. We are going to celebrate our 26th annual News Radio 103.1, 810 WGY, and 99.5 The River Cares for Kids Radiothon. So Radiothon, I'm wearing proudly my Children's Hospital for the Bernard and Millie Duker Children's Hospital emblem. Very proud to be a pediatric specialist. It's a really important event. It will be held Thursday, May 2nd, Friday, May 3rd from 5:30 a.m. to 6 p.m. Please help us, donate, participate. This year we have more than 20 families who will be sharing their stories. Last year we raised $330,000. Incredible.
Incredible.
What a great cause. So proud to be part of our spirit here at Albany Med to support our Children's Hospital. So thank you for all that participate. And we'll look forward to that. How do we do?
I think pretty good.
Not too bad. Excellent. I'm sure Dr. McKenna will be proud of us.
So proud.
Excellent. You want to take us out?
Sure. Thank you so much for joining us today. It's a privilege to be in front of you and to be here in this organization with you. I think he says, take care of each other, take care of yourself, and we'll see you next time. Thank you.
Excellent. Thank you, Dr. Kalisi.
Thank you.